Thank you, Chair, and thank you all. Thank you for this fantastic opportunity to talk about the consultation. So obviously I'm here on behalf of the Health and Wellbeing Board. I'm not myself a member, but I'm supporting all the work on the consultation. As you know, Simon and Jonathan are members of the board and have been absolutely fantastic and instrumental in supporting the work of the board in getting to this point and launching the consultation. So really grateful to them for their advice and input and support. So the Health and Wellbeing Board consultation is in its 6th week and will be out to consultation for 12 weeks. It's a fantastic opportunity for everybody who lives, works, studies in Worcestershire to make their views known about the future strategy. The strategy will run for 10 years, so it will run from 2022 to 2032. It will be backed up by action plans that will be reviewed at regular intervals to ensure that we're really doing the work that we need to do, that the Health and Wellbeing Board needs to do to improve health and wellbeing and to address inequalities in Worcestershire. So we all know that the pandemic has affected all of us in different ways. We know that it has widened inequalities. And the Health and Wellbeing Board has been on a journey over the previous year to consider what the new strategy should focus on. The board considered all of the information from the Joint Strategic and Needs Assessment, from engagement work that I know many of you were involved in, and we're so grateful to you for that. We're grateful for the Health Watch reports as well. There's a reference in the consultation document that's helped the board in making its decision. And so the board is consulting on a proposed single priority around good mental health and wellbeing under the banner of Being Well in Worcestershire. And the board proposes to take action as well on some of those broader determinants of mental health that are referenced in the consultation document. So that's healthy living at all ages, safe, healthy homes, communities and places, and quality local jobs and opportunities. So as I say, this is a 12-week consultation. We've had almost 1,200 responses so far to the online survey. That survey, as I say, is online. It is backed up by paper copies available in local libraries for those who don't have internet access. We would be so grateful to all of you to support any individuals that you know that might need help in completing that, and the groups that you represent, and making sure that this consultation does get to those communities that we really need to hear from about what they need to be well in Worcestershire. I'd also like to stress, as it says in the consultation document, that the survey is one way that we're collecting views. There have also been over 30 focus groups commissioned across Worcestershire with a range of different communities to find out how COVID has impacted on them, what wellbeing means to them, and what they need to be well in Worcestershire. So that's all I wanted to say, really. Just thank you for this opportunity. Thank you for your support in promoting the consultation. An absolutely great opportunity to really influence health and wellbeing over the next 10 years. And I do wonder if perhaps Simon or Jonathan may want to come in as well as members of the Health and Wellbeing Board around the consultation. Thank you.
Thank you very much. Simon, do you?
Yeah, I'd like to say, I mean, I don't think we can underestimate, having been around health and wellbeing strategies in Worcestershire for, I don't know, nearly, I suppose, 15, 16 years now. I don't think we can underestimate what a big departure this is from the norm, can we, Tanya? Where we've normally seen strategies that have been about secondary prevention issues, that have normally been about trying to smoking cessation, taking more exercise, those sort of issues, rather than actually getting right to the determinants of people's health inequality and people's health. And it's really important, I think, that everybody takes the opportunity to respond to this consultation and to promote this for you from organisations to promote the consultation. So from people like Pete Saigon, our board, who runs an infrastructure organisation for young people's organisations, I know he raised at our last meeting, could we have an extension on the time, as I think Jonathan did as well on behalf of the voluntary sector, and we really welcome that approach to say, yes, okay, we realise how important this is, and we really do need to drive to get feedback from people about this approach, because this is probably, you know, they say once in a lifetime, but an opportunity that Worcestershire has not had before, and we need to seize the day, as it were. Jonathan, over to you.
Thank you. Tanya, thanks for thanking me. I don't need the thanks, but thanks for mentioning it. For me, the upstream primary prevention seems to be an important part. Can I just ask then two questions? I wonder what feedback you've been getting, if you're able to perhaps synthesize a bit of it, because I do wonder if the sort of the headline of the consultation and healthy mental health has perhaps triggered an overemphasis on mental health services, when what we're trying to convey is that the access to services, one, important, it's only a small determinant of our overall health and well-being. Housing, our places where we live, our childhoods are more important as well, equally important. So that's the first question. Is there a sort of skewing of the feedback, perhaps misinterpreting what the health and wellbeing consultation is about? And secondly, you know about Marmot and the Marmot reports of 2010 and 2020. Now, this doesn't mention Marmot, but it implies a Marmot type upstream approach. Is that correct? Would you agree with that analysis? It doesn't say about Marmot, but it looks at the kind of approach that Marmot would advocate.
Thanks, Jonathan. So on the first question about the feedback, obviously where the consultation doesn't close until the 2nd of May, so I wouldn't want to comment at this point. What I would say is that we will be synthesising the feedback from both the survey and also all the really, really rich qualitative data. And there are huge numbers of comments coming through. We're absolutely delighted, and we are so excited actually to see what will come at the end of this in terms of the insights, I think, into communities that we won't have had before. So I think it's premature to comment at the moment. Thank you for that reminder about those broader determinants. For those of you who actually looked at the consultation document, you will see there's a person in there representing the things that impact on our health, and you will see that obviously the major contribution that those broader determinants that you referenced, Jonathan, make to our health, those wider socio-economic factors, the physical environment, as well as having access to the good quality healthcare that we need. In terms of your second question, obviously the role of a health and wellbeing board, the role of a health and wellbeing strategy is to address inequalities. We know that Worcestershire is an affluent county, but there are those pockets of inequalities that are masked by the overall good performance that we have. So absolutely, we need to be taking the evidence-based approaches to tackle inequalities in the county.
Thank you. Lee.
I was just going to say, I'm one of the organisations that ran a couple of the focus groups, and I'm just a little bit concerned at the moment, the data capture from those focus groups towards the strategy, a little bit what Jonathan was saying, but from a different perspective. At the moment, when we were doing the focus groups, it was very much aimed about how their resilience through COVID and their experiences right now about COVID. And both of those groups that I ran were very much sort of still on that back foot of COVID. So if this is the strategy for the next 10 years, you know, going through, I think it's an unfortunate time, because at the moment they feel very let down by the GP surgeries. There's a lot of negative feeling of the relationship between them, and they're very worried about the impending financial situation we're about to go in with regards to the cost of living. And I think that at the moment, that's for them, that's because they've just gone from one crisis straight next to another, what they feel is another crisis. So I feel that some of the things that they might be capturing on the consultation might not necessarily be broad enough. It might be very much affected by very much the here and now, that might not necessarily be relative in the near future. So I thought I'd just, because obviously that's the feedback that we got from both those groups, were very much about the very here and now due to COVID, because it's their first time of sort of coming out for a lot of people. So I think we need to be very aware of that, how that reflects on the consultation.
Yeah, thank you, Lee. Thank you. Great points. And my colleague who's leading on those had shared that early feedback yesterday. The consultation document talks about the fact that we are aware of some of the impacts of COVID, but not all, and things are emerging and changing all the time, as you say. This will be a strategy for 10 years, but as I say, we'll also have review points and be backed up with action plans. We hope that we will be able to repeat focus groups and get into a much better cycle in engaging with members of the community in that way. So I don't think things would be static, but we'll be informed by the changing needs that we see in local communities. So thank you for that.
I also just say that with reference to some of the paper copies going to the libraries, the Sandcroft Centre in Redditch is smack in the middle of Redditch. And a lot of the BME community access our services, and we've raised it many times. They're not very confident with doing online surveys, so we've always where possible done paper. So it's making sure when you are doing those consultations that those marginalised groups, that you are making sure that the paperwork is going to those groups. Not, I mean, I'm on the Health Watch board, and I'm obviously in contact with public health, but what about if I hadn't have been? So it's making sure that the right organisations are targeted for those groups, because the Redditch Library wouldn't have been the most appropriate in Redditch.
Thank you, Lee, and perhaps I'll ask a colleague to get in touch with you to make sure that you have, and if any board members would like paper copies to take to particular groups that you're aware of, we'd really appreciate that, and we're happy to provide those for you.
Good.
Pete, did you have a question?
Yeah, just going to say that, and this is a good example of it, it's been really good, the amount of interest in the process, particularly from minority groups. So the bit that I'm interested in is about making sure that materialises in terms of feedback, so those groups are both, they are being consulted and actually are able to feedback, but also what we do about it. But I think so far the process seems to be going well, and people are involved. We'll just pick up on the grapevine that people are involved who probably wouldn't have been involved before. So good on everybody for doing it. But taking Lee's point, we've got to keep pushing, particularly for those groups who are still very isolated.
Thanks, Pete.
Thanks.
Lee, is that still a legacy hand? I'm going to open it up to members of the public now. Gaynor, you've got your hand up.
Yeah, I was just about to say of what was just mentioned earlier about the paper copies. I didn't know there was any paper copies around, so I was going to ask about paper copies. My support group that I run that don't all go to the library very often, so they wouldn't have found it. So could we have any paper copies posted to us, please?
Absolutely. I'll ask a colleague perhaps to get in touch with Simon to make sure that happens to anybody who's on the call.
Yeah, okay then, thank you.
Thank you. Oh, Brendan, you have a question. You're still on mute, Brendan, sorry.
Yes, sorry again, Joe. I'm involved in a number of aspects of health and well-being, virtually from the most, what would we call it, simplistic level of well-being, right up to the most critical aspects of health. As such, there are a number of bodies, and obviously the ICS/ICB, the Health and Care Trust, the Section 117 group that I'm a member of, and various other activities across Hereford and Worcester are being decided, if you like, within a joint context. Question I would like to know is, to what extent is this so-called Worcestershire Wellbeing strategy in interacting with what's happening in Hereford? And just as an aside, I was involved in the appointment of a new Associate Director of Mental Health and Learning Disabilities, and it was made recently, and it was made quite clear to the candidates that their role would be involving aspects of well-being as well as mental health services across Hereford and Worcester. So is my question obvious? To what extent is there some sort of integration and taking into account the Hereford situation within the Worcestershire context? Sorry if I've raised something that's a bit awkward.
No. Thank you, Brendan, and thank you for your earlier comments. I know my colleague has chatted to you about your support to promote the consultation with the groups that you're involved in, and we're hugely grateful to you for that. In terms of the work with Herefordshire, clearly Herefordshire Health and Wellbeing Board have a responsibility to produce a strategy, and I think that they are in the early development stages of that. It's remarkable, the synergy actually between the strategies, and I think the proposed priorities that they will be going out to consult on are very similar to those that the Worcestershire Health and Wellbeing Board has chosen as well. In fact, we have a meeting being put in the diary very soon for the chairs of the boards to discuss how they might want to work together more closely. And as you say, with the development of the integrated care system and the strategy that will be required, that will very much take account of the local strategies of both boards. So what that integration piece is definitely being considered. Thank you.
Okay.
Thank you, Brendan. Does that answer your question?
Yes, thank you.
Right, thank you. Are there any further questions? So thank you very much, Tanya. That was a really good and interesting presentation. Thank you.
Thanks very much for inviting me.